Launching the Hand Hygiene for All strategy and roadmap to mark Global Handwashing Day in Cape Coast, Sanitation and Water Resources Minister Frida Prempeh entreated Ghanaians to embrace hand washing as part of their daily routine to help curb the spread of illnesses. She noted that research shows that hand washing with soap prevents diseases more effectively and affordably than any single vaccine. Madam Frida Prempeh noted that the initiative goes beyond a campaign, signaling the government resolve to make basic hand hygiene accessible across the nation to safeguard public health.
We have adopted saving lives through hand washing with soap as a national theme since the inception of Global Hand Washing Day in 2008. The theme recognizes the recent rise in hand hygiene commitment and action to save lives. While great strides have been made due to the COVID-19 interventions, Honorable Minister spoke about it, there is still a lot of efforts needed to ensure that Ghanaians make hand washing with soap a daily priority. It is estimated that only 48% of Ghanaians consistently wash their hands with soap. These people basically have access to hand washing facilities at home. The report further indicated that 24% of households have designated place or devices for hand washing, but without soap and water, whilst 28% have no facility at all at home for hand washing. When hands come into contact with germs, you need to wash your hands. The report also shows inequalities in coverage of basic hand washing facilities, which range from just 42% in the rural areas to 56% in the urban areas. The inequalities in hand washing facilities and ineffective hand washing promotion programs can put individuals at higher risk for diseases that impact their health, education, and economic outcomes.
Central Regional Minister Justina Marigold has called on Ghanaians to make hand washing a priority. She says the strategy put forth by government aligns with Global Hand Washing Day, an annual campaign to promote hygiene as a fundamental health intervention.
When you go to Kotokoraba market or any of the markets, you ask yourself, do the women use the washrooms? Do they go to ease themselves? So if you don't have the running waters there, what do they do when they come back? Your guess is as good as mine. So when they come and somebody is coming to buy tomatoes, they grab it for you. And if you are also so hungry, you go home and you don't take your time to wash it well, then it means you are also eating somebody's feces. So this is an exercise we need to embrace and support the ministry to do. It's not even after today, but it should be something with us to ensure that it becomes a habit and we continue to clean our hands in our various homes and institutions that we find ourselves. And somebody will say that soap, they don't have money to buy. But community water and sanitation did something beautiful. The ash we use, the normal ash, that one you will not go and buy it because we have been cooking and the ash is a bonus something for us. That was what we were using. And we were able to improvise some of these things for them to use to wash themselves or their hands. You just tap it with your leg and the water will be flowing because we have a gallon of oil, that container, fixed to a pole. When you touch it, the water will be coming. So it is not expensive. Wherever we find us, if we are able to buy it, let's get to people who cannot afford and support them to be able to also provide for themselves and the communities that they find themselves.
The Hand Hygiene for All roadmap outlines specific actions for stakeholders, including increasing public awareness, training health workers, providing hand hygiene facilities to institutions, and monitoring progress from 2022 to 2023.